Okay, so we'll get started. Thank you, everybody, for being here for this special meeting. We'll begin right away by bringing the meeting to order. And we'll move over to the approval of the agenda. So if there are any items for other business, now is the opportunity to identify that. Does any committee member have any items for other business? Andy?
Yeah, I'd like to discuss a few things that I've been talking to homeless people about, and I'd like that to go on the agenda. Did you want me to itemize them or just?
Okay, so when we do other business, so other business is for making a statement or asking new questions, but it isn't to introduce new business items, basically. So I would say that what we can do is if you want to if you want to basically ask questions or make the statement, but the process would be that new business items would be added to an agenda for a separate meeting so that they can actually be addressed by city staff. So that's good though. So I'll make note that you do want to make a statement for under new business or to ask new questions. Does that work?
Yeah, if that has to be that way. There's a lot of questions though that keep being asked and the staff are not answering. So it's a concern to a lot of people that are homeless. So either way, but I'd like it to be made aware of, and I'd like all these questions to be actually answered this time.
Yes. So part of this meeting, so it is a special meeting, and basically I've called it in order to hopefully establish a working group to review the terms of reference for the committee. But these meetings have a very formal process, and basically that's going to be that everything will be reviewed as part of hopefully a working group. Sorry, Councillor Neal, I saw your hand as well.
Yeah, just quickly. Anytime we want to bring an actionable item to the committee, all of our committees and council, you have to make that available in writing to the clerk the week before the meeting. And it's a frustrating rule sometimes, but the reason for it is to allow the public an opportunity, if they're concerned about it, or other members of the committee to be aware that that's coming up on the agenda. So it is a frustrating rule sometimes. It can be, if it's something overwhelming and 2/3 of the committee want to agree to put it forward, we can ignore the operational bylaw, but otherwise we need to follow that protocol. Did I get that right, Elizabeth?
Madam Chair, I do believe that Councillor Neal is correct there. In terms of other business, we really do have an obligation to members of the public to make sure that we are giving every opportunity possible to attend the meetings and to be able to speak to the matters that are addressed. However, you know, if Ms. White has some questions, if she'd like to make a statement, that is definitely within the procedural rules to do.
Yes, exactly.
And I'll just add that because Ruth Nordegraf, who's the director, is on, if something comes up, it can sometimes be handled by staff without a formal motion. So that's worth the consideration as well. And I think I stepped on Councillor Doherty, who had her hand up.
Yes.
I apologize.
No problem. You're just trying to help out, Councillor Neal. Please go ahead, Councillor Doherty.
No, that's no problem at all. I really appreciated what you said because it took me a while to learn that as well. I got frustrated at the very beginning when I joined not just this committee but others too, when I couldn't just bring concerns forward, where to me it just made sense that we just discuss these because it's through discussion that we move forward. But it is, as Councillor Neil just said, it gives everybody, including the public, an opportunity to participate in those discussions. So it actually does make sense. Having said that, when on today's agenda is the communication that we received from Crystal Wilson, and maybe some of the similar concerns will be brought up by Ms. White. And do we ever discuss communication, or do we just receive communication? I guess that's a question to the clerk because I'm still learning to, Andy.
Madam Chair, through you to Councillor Doherty, the correspondence that is received on the agenda is not up for debate. However, if a correspondence item pertains to business that is on the same agenda, correspondence can be addressed and discussed during the business item itself.
Yes. Thanks, Chair.
Perfect. So I've added that, Andy, that you'll have statement or new questions under new business. Is there any other from committee members? Okay, perfect. So we'll move over.
Can I just ask one question then?
Yes.
So I kind of understand it a little bit better. So I can prepare questions that I will pass to everybody, or will it go through the Elizabeth? Will it go through to Elizabeth? And then it will be dispersed to the committee?
Well, the mechanisms, yeah. So the mechanisms for introducing new business are reports from staff or new motions from committee members. So generally you would reach out with those in advance of so you would reach out with it in advance of the meeting, as Councillor Neil said, by about a week, in order to give them time to review and in order to put that on the agenda and to be able to ensure the public can also be a part of it. So when we introduce new business as an item, for example, at this meeting, it would be in form of a statement or new questions, and certainly it can be reviewed following that and potentially, depending on the business, added as an item, either, a report from staff or a new motion from a committee member.
Okay, and the other thing I'd like to have clarified, so the correspondence that Crystal Wilson sent, we don't discuss that. Is that correct?
My understanding is that we don't. Elizabeth, I will let you take over there.
Thank you, Madam Chair. Again, correspondence can be discussed within the context of the business item itself. So if there is an element within that correspondence that a member wishes to bring up during discussion under the business item, that is permissible. It is just not discussable or debatable during the actual correspondence section of the agenda.
Okay, thank you.
Of course.
Perfect. Was there any other question in regards to that? No,
I'm fine right now.
Thank you. Councillor Neil, I saw your hand.
Yeah, just quickly, for Andy's benefit, if there is an action that you were hoping to bring forward, you can always bring that forward at the meeting under a notice of a new motion at the end of the meeting, and that will go on to the agenda of the next meeting. So, and I'll shut up now. Thank you.
No, that's perfect. That's very good. Thank you. Okay, so then we'll move to approve the agenda. Can I have a first? Thank you, Michelle. And second, I saw Councillor Neil. And all in favor, please. Or anyone who's not. I think I see all hands. Perfect. So we'll move forward then to confirmation of minutes. Now, there are no minutes to be confirmed until the next meeting. So we'll move right over to disclosure of pecuniary interest. Is there any here? No? Okay, seeing none, we'll move over to delegations. We have no registered delegations today. And so we'll move right into briefings. We have Ruth Nordegraaf with us, who is Director of Housing and Social Services. She is present to speak to the committee regarding the Housing and Homelessness Advisory Committee Terms of Reference Review. So I will pass it over to you, Ruth. And following Ruth's presentation, we will then be able to ask questions as a committee.
Thank you so much, Madam Chair. Can everybody hear me?
Yes.
Awesome. So we do have some slides that I would ask that. There we go. Thank you so much. So today, obviously at this special meeting, we staff created a report between the clerk's departments and housing and social services departments to basically request or recommend to the current terms of reference of this committee. So on the next slide, there we go. And in addition, as you might have seen in your package, we also have added in the info reports that we also officially starting April 8th, the next official or next meeting with a standing agenda item or a standing report, I should say, that will provide you with an update on the various kind of elements of the housing and homelessness division. I think this way, we hope that you would have a good understanding of the various elements that we're working on. You know, we obviously talk a lot about specific items in the portfolio, but again, we also all have learned that there is some opportunity to improve communication and have more information shared. So this way, by creating a standing agenda item or standing report with updates will also allow the committee to then, have a conversation about items. So today, I just wanted to touch on the terms of reference review process and also actually provide you, since that has been referenced in the report, with a quick overview of the three areas within the housing and social services kind of housing departments, and give you some updates on where we are on the various initiatives. And as Madam Chair mentioned, after that, I'm happy to answer any questions. So the next slide. The terms of reference of this committee and the current mandate is really focused on providing advice to City Council through the Arts, Recreation and Community Policies Committee regarding housing and homelessness related policies, directives, strategies, and as well to support with the implementation of the 10-year housing and homelessness plan. So obviously that's a very broad statement and something to obviously kind of further discuss and process what that looks like. So in the next slide, and of course we've had received some questions and concerns about what this committee is discussing and how it's being discussed and how we're kind of moving forward with items. So obviously that was a really good opportunity to start the conversation around the terms of reference. So, and obviously, as you can see, the last time the terms of reference were revised was in 2013. So again, in response to some of the conversations and also just the change in landscape, we are requesting that we are requesting input on the mandate and the structure and kind of the committee as a whole. So obviously, what the content of the terms of reference would also speak about how the reporting structure looks like. And currently the committee is reporting to the Arts, Recreation and Community Services Committee and then goes to council. We're currently meeting 4 times a year. I know we have the ability to add special committees, but we also may want to have a look at the current membership and the current kind of content items that are defined in the terms of reference. So what we are requesting, what we're proposing as staff, is to create a engagement process where we obviously would like to hear from members of the public, but also would like to obviously hear from yourselves as committee members. And therefore, we would like to recommend that we set up a working group with a subset of these committee members and some of the city staff. And we would also then obviously use the engagement process to get some feedback from the broader community. The one complexity, and I know Elizabeth and I think Janet, Jane's deputy clerk, is on the call as well, is that we do at this point, if we recommend an item, we do have to go to the Arts, Recreation and Community Services Committee, and then we would get the report to council. So that means that that there will be a bit of a delay in moving this forwards, and therefore we are suggesting that we go through this process and report back to this committee by the end of Q3 2021. That doesn't mean that we obviously are going to, do things or like, for instance, adding this standing agenda item with the updates every meeting and are making some changes in the way we work with this committee. So in the next slide, that's kind of the quick kind of introduction of the report that's in front of you. What we also identified in the report is, as I mentioned, that we would like to introduce this ongoing updates for you, so you have a good understanding of all the different things that we are working on. And because it's on the agenda and in the report, I took the liberty of already giving you a quick overview of the various projects and initiatives. The next slide, please. I would like to start with the Homelessness Services. And as you might recall from the meeting in January, as part of the 10-year plan and as part of the work that we do, we have our Homelessness Services, we have a social housing component, and we have an affordable housing component. So I'll split this in those 3 components. Of course, we all have been very involved and very focused on the pandemic response. And I just wanted to kind of highlight here the different kind of services that we currently have in place. We have a really great partnership with public health and all the different partners and have a good kind of, I would say, pandemic response in place with IPAC teams and various kind of ways to really make sure that we are as safe as possible. We obviously, as you also know, had to make some changes in the capacity in the shelters. And I just gave in this slide an overview of the current kind of capacity within the pandemic response. As you also will see, we have, and you're quite familiar with this as well, I would gather, open up the Integrated Care Hub as a new facility in our community, also as part of the pandemic response. And we have a temporary overflow on Brock Street, funded by the United Way. And I will say that there is a report going to council next week that will also request to continue with the Integrated Care Hub a little bit longer, so we can actually continue to do the much needed kind of stabilization of clients in the Integrated Care Hub. So this is kind of where we are as for pandemic response. I should say that we also have a hotel or motel option. The family shelter, for instance, has some families that are currently staying in hotel. And depending on kind of the client and the process, we do have the ability to, again, through our partners and depending on clients' ability and the support that the partners can provide, we can also work on that. So on the next slide, and I'll try to keep this in 10 minutes. I also wanted to highlight that we also actually have been over the last year very closely working with AMHS that has been operating a self-isolation center for homelessness individuals. You might recall that initially we had a self-isolation center in the West End. We now have a much, I would say, more scalable model with in a local motel. And AMHS has been supporting clients that cannot access the shelter because they might be exhibiting COVID-19 symptoms or if they are coming from out of town. And to date, there have been over 50 individuals referred, and 3 positive cases have been able to self-isolate. So you can imagine, and again, you might have been reading or hearing about other communities and other shelters that this has really helped us to really kind of respond in a way and keep everybody as safe as possible. As I mentioned, we have weekly calls with the outbreak management team. We also have ongoing surveillance testing of clients and staff. And there is a vaccine, obviously a vaccine rollout that we're all waiting for, but the congregate living and kind of the shelter settings have been identified as a high priority. So we're hoping that, again, depending on number of vaccines, that they will be hopefully vaccinated in the earlier waves. So the next slide. Again, I will not, I know this is obviously a really important component, our Homelessness Services review, system review. As you might recall, we have expiring agreements with all the providers at this point. We have a lot of lessons learned from the system over the past 5 years, including what we've learned over the pandemic. And we have changing needs of clients and changing realities. This review is focusing on all elements of the system, and I just highlighted them here. And it also will look at the role of the service manager of the city, the community partnerships and collaboration and system accountability. We have been able to engage with a lot of different partners, with clients. We also have been using data that we have gathered, for instance, over the summer when folks were in Bell Park. We also have actually been able to work with a professor that works both in Kingston and should say Hamilton or Waterloo, I always get them mixed up, and has also at the same time doing some really great research and has done a lot of engagement with clients and partners. So there's a lot of really good information at this point, and I'm hopeful that we will be able to provide you with an initial kind of overview of some initial recommendations. We also will be working in the next 2 months on identifying, kind of the content and the input for the request for proposals that we will be preparing for Q2, end of Q2, to actually go back out to the system to obviously first go to you and council to identify what we think has been well and where we think we may need to where we need to make some changes, and we kind of will walk through that process with you at this committee, and obviously we would very much appreciate your input on the drafts as well. The other piece that I would like to highlight is we are also, and this is obviously very closely connected, on an encampment framework or an encampment strategy. This is actually a motion that came from council in 2020. And we are working with our internal departments and also with our external partners on making sure that we have a good strategy in place that will support clients and also will have some clear kind of steps in place around encampments. You might recall that we also were asked by council to review the United Nations protocol, and that will be part of that report as well. So there will be a lot for you to look at in the near future. And I should say for the encampment strategy that we are also obviously learning a lot from our other communities in the province, and have some really great ideas on how we can better wrap around services and support clients if they are living in the rough. So the next slide. I also, again, wanted to highlight that we are making some really great progress with our evidence and our kind of data management. So we do have a quality by name list. And really a by name list allows us to identify trends and make better evidence informed decisions to better serve our homelessness members of the community. Again, it gives us a better handle on the inflow and the outflow in the system, and it gives us much better data on gender, where people are coming from, how they're being referred. And we've recently started with a better I would say wraparound kind of case management system as well, where we can actually attach services to people that are on the by name list. On the next slide, this is actually new. We are actually also now going to be a quality veteran by name list. And I know Joanne Boris and Kat Riley are on the call as well, and they would have much more to say about this. But it basically means that we also now have a quality by name list, and we know how many veterans are homeless. And this also will allow us, again, to establish better partnerships with, for instance, Veteran Affairs and the Royal Canadian Legion. So the next slide. So jumping to social housing, as you, again, as I mentioned in my presentation in January, we kind of the fairly, I would say the other component in the housing division is social housing. We are mandated or legislated to provide or to manage 2003 units, RGI units, and what I would like to do is just go through the kind of 3 areas that we are focusing on in this sector. So the province is working on the community housing renewal strategy, and has identified supply, people, and system as kind of the 3 key areas. For the local Kingston and Frontenac area, that means on the supply side, for instance, that we are really focusing on making sure that the current supply is well maintained, and that we're also increasing supply. So we have been able to use our COCHI dollars, which is the Canada-Ontario Community Housing Investment, for year 1 and year 2 towards capital repairs with our 16 different housing providers. As you know, and we'll get there, we're also looking at or in the midst of developing more affordable housing builds. And we have been able to now add 85 new portable housing benefits in the system. And I also wanted to add that in 2020, we've been able to do, in 2019, to do a lot of testing in the social housing units and we've been testing for radon. And we were able to, for those units that did have a slightly higher kind of testing results, we were able to mitigate the radon as well. So there's a lot happening on the supply side. On the people side, and we'll get there in a minute, we are also looking at different ways of supporting people when they are either on the wait list for housing, and we have about 1,000 people right now on the social housing wait list, but also when they are actually housed. So Kingston Frontenac Housing Corporation, which is a larger provider in our community, has just launched a supportive housing or supportive services pilot that we'll share a little bit more about. We are also working on provider training, for instance, in the Indigenous, the Black Indigenous, people of color, or trauma-informed training. So we are providing or facilitating training for providers. And we are also quite often working with Queens. For instance, Queens did a study on reviewing how our social health, what we can do with our social housing wait list, how we, for instance, can work with people when they're on the wait list, and how we can make the application better. On the system side, and this is still very much legislated by the province, but we were able to implement a lot of new and cut down some red tape on some of the rent geared to income calculations. And we're able to kind of update our application so it makes it a little bit more user friendly. So the next slide. So on the social housing side, I also wanted to highlight, I will not talk through all of this, but because this will come back to you on April 8th as well in a full report. We are, the 16 housing providers, they all have obviously mortgages that will start to expire. So we have operating agreements that will expire when the housing provider's mortgage is paid in full. This is happening across the province, and we are managing through what that means for us as a service manager and what that means for our housing portfolio. I should say that Kingston Frontenac Housing Corporation, which obviously has the largest amount of housing, is an exception in this process because we have a direct shareholders agreement with them. For the other providers, we are working through kind of different options depending on the housing provider status. We have now had a few that came there where their operating agreement expired, and we were able to continue with them and renegotiate our operating dollars. We also, and this is still a bit of we still have to wait what is going to happen with the provincial bill, Bill 184, but we also will have an opportunity to look at, for instance, other additional PHBs, additional rent supplements, or look at more mixed income buildings. So for instance, sometimes we have a social housing building that has only rent geared to income units. Sometimes it makes sense to flip some of those RGI units to market units and then add PHBs in the system. So we're kind of, it's almost like this big puzzle where we are trying to make sure that we make the best use of our funding and continue to serve clients. And like I said, we will come back to you with a full report on the 8th. So next slide. Real quick, I mentioned this already before I flip to the affordable housing components. We are working with KFHC. We were able to provide them with some pilot dollars. As we know that quite often tenants in their social housing portfolio might be struggling with various complex issues, including health or mental health and general life struggles. So this pilot is providing crisis services, direct assessments and interventions, and it's also providing like ongoing support to engage with community services and resources. It's just been rolling out over the last few months, so we don't have we'd always obviously come back with you with some data, but one great example, and I know this was maybe not a good example, but you might recall that there was a fire in Verona in early January. And this actually through this program, they were able to have their staff and their really kind of support the clients and manage through this process. Obviously, that was not the intent of this process, but it was really a great example to see how it was very helpful to have additional support staff in a social housing environment. The next slide, and I'm almost there, is the last part is kind of the affordable housing programs. So we obviously are working through some capital developments. We have 27 rights, which is under construction, and we're hopeful that they will be able to have occupancy by the end of this year. We're also working through 1316, 1318 Princess Street, which will add 80 affordable, or basically 90 new affordable units to the community and market units in addition. And then we have been funding through provincial dollars last year through the Home for Good program, funding towards a new development on 484 Albert Street, which will add transitional and supportive housing for youth to the community. As you also recall, we have two supportive housing acquisitions. We have the Lower Union Street location that's currently being used by the youth shelter, and we have the facility in West End, which we will be releasing an RFP for in hopefully the first week of March. And then we also have a few other programs. So we have a home ownership program where actually in 2020, we were able to allow, and it's not a super high number, but it still adds to, I think, that additional toolbox of tools. We have had 8 families that were able to purchase a home with our support. So we provide support with the down payment of the home. And the new program for 2021 will start next week. So spread the word. And the next slide. We also have a Kingston Frontline Renovates program where we support with urgent repairs. And in 2020, we were able, and obviously the uptake was a little bit lower, but we were able to provide 16 people with urgent repair support. We also were able to support some social housing rehabilitation projects. And this program will also, the 2021 program will start also next week. We also have a secondary residential unit affordable housing grants. So in the city, and we have been able to develop, and we've been able to make some changes in our bylaw over the last few years, which allowed for more opportunities to develop second residential units. And you will see that that has been quite a positive number at 117. We also provide the opportunity for those individuals that are interested in providing a second residential unit and they live in their own home and are adding, for instance, a basement apartment. We are able to support them with those costs as long as they maintain that unit as an affordable unit. That program has not been as successful. Again, it's probably because of some of the requirements, because we only had one project approved in 2020. We also keep going and moving forward on the Rideau Heights regeneration. Obviously, we have phase 1 with the community center and the streets, and then the phase 2 land use planning application, which is currently under review. And then this is, I promise, I think my last slide. Next slide, please. So 3 other pieces that I wanted to just point out that are quite often happening and coming up and are in, things that we work on, and we do many other things, but this is the highlight. We quite often get involved, unfortunately, in some hoarding challenges. So we are part, and we've kind of reestablished with our partners the Hoarding Coalition, which is, as you can see, it has our team, Kingston Fire and Rescue, police, Homeless Housing, AMHS, to really develop more of a hoarding response protocol in the community. We also have been working a lot with our colleagues at Property Standards and Communications to really make sure that we have the right kind of information and communication out there for tenants and landlords to really make sure that they have a good understanding of rights and responsibilities. And I know this is obviously not necessarily like everybody will go online and read on Twitter, but there's many other ways that we're sharing this information through our partners. But we've tried to be proactive with some tenant rights and landlord rights communications. And the last part is that we are, and this came out obviously of our 10-year plan, but we are also starting our first meeting of I would say it's a supportive housing roundtable that is going to meet regularly with all the partners that are involved in supportive and transitional housing to really, increase partnerships, communication, and innovation. So that's probably not 10 minutes, but that's an overview of where we are and what we do. I'm happy to answer any questions on the terms of reference or on any other components. Thank you.
Thank you so much, Ruth. I appreciate that. Thank you. So I will open it up to our committee for some questions. And then just so you know, once we have finished questions under this section of briefings, we will again be able to ask questions under business. And that is also following the committee being able to ask questions of Ruth, where I would ask if there are any members of the public present to be able to also ask questions. And members of the public are also welcome to speak up to 5 minutes in order to ask their questions. So do we have any questions from our committee members? If I could see some hands. Jim, Neil, Councillor Neil, and Councillor Doherty.
Sorry,
Okay.
I keep
Yeah.
by a millisecond beating Councillor Doherty's hands up. That was an excellent presentation. Thank you, Ruth. Could you make that slide deck available to the committee through our clerks and possibly to the mayor and council as well? That was put a whole lot of information together. I appreciate that. Just a couple of quick questions. Lily's Place going from 17 to 12. Is that COVID related? And is there a chance when we get COVID behind us, hopefully this fall, we'll be able to go back to 17?
Sorry, through you, Madam Chair. I'm happy to answer your question now, or if you want to ask all your questions at the same time, because you said.
Yeah, I can ask them all at the same time. My other question was, I just received email 20 minutes before this meeting asking me if there's a where we would recommend as a warming center. And I would assume that it's on Montreal Street, but is there other? I know during the day there's the public library when we're open and elsewhere, but 24/7, do we just have the one warming center?
Through you, Madam Chair. So thank you for those questions. So first of all, Lily's Place, and same with all the other shelters, the reduction in capacity is really because of the infection prevention control measures. So the intent is that all facilities would go back to their quote unquote original capacity, including Lily's Place. I will say though, and I think that this is again something that we see across the board, the pandemic has certainly raised a lot of questions around the way we do manage shelters and the way we create congregate living environments. There are pros and cons to, I think, both, and it's definitely something that we want to keep in mind moving forward, because there might also for some situations it's better to look at individual rooms. In some situations, it might not be a good decision. So short answer is it's temporary, the reduction. Again, that's why we do have things like an overflow and obviously integrated care hub. For Lily's Place, because it's families, or there are, as I mentioned, more families that are using a hotel at this point to make sure that we have those supports in place. Your question about the warming center, yes, you're correct. At this point, the integrated care hub is the only 24/7 warm place. We do have, again, it's all bits and pieces, but we do have to, as to your point, the libraries, even our building here at 362 Montreal during the day, downtown. We also have the Stages facility, so Street Mission and Lionhearts, who are providing a few hours of a drop in the evening. So that's the only warming center. You might recall that last year was actually the first year as a city that we funded a pilot warming center downtown, and obviously now we have the integrated care hub. So yeah, those were your questions. So I hope.
Thanks, Ruth.
Thank you, Councillor Doherty. I had seen that you also had a question.
Thank you, and through you, Madam Chair. So I'll just keep it to 3 questions, although I have lots more, but I don't want to take up too much space. So my 3 questions are about the engagement process, the encampment strategy, as well as a John Howard Society project that's currently taking place that I've been attending. With the engagement process, I wonder, Ruth, if you could share. Actually, before I really start with my question, I just want to really thank staff, because you're really on the receiving end of a lot of criticism and concern, but that criticism comes from concern and caring from the community. So I totally understand where it comes from. There's a lot of frustration because a lot of people in our community are actually suffering. But at the end of the day, you guys are wearing it all on your shoulders, and I really just want to acknowledge that, and that's not an easy position to be in. There's a lot of frustration. A lot of this comes because we actually need more support from other levels of government, but it's here on the ground in our community. It's where it's hitting us. Actually, that's my 4th question that I had. So I will ask that question at first, actually, and that is the restrictions with the province, for example, rent geared to income. That has a specific number of spaces. Can we go above that, and do we go above it? The same for the portable housing benefit. That's kind of an initiative that we've introduced, but that is going beyond what the province is actually supplying. So I wonder if you could speak to that first.
Thank you to you, Madam Chair. Well, first of all, thank you for the recognition. I mean, I think we all care about the same things, and I think we all have different roles. And I think the frustration that people feel, I will tell you, we all feel frustrated, because I think we're just really trying to navigate the things that we can and the things that we can't control. And we certainly have things that we need to do better, I think, as a community. But I appreciate that very much. So your question about the RGI restriction. So we can do everything we want as long as we have 2003 units and we kind of hit that service level standards or agreements. I should say that might also change in the future. That number has been there for 20 plus years, and obviously it doesn't align with the actual core housing needs in our community. The question is obviously, how much do we want to spend, or how much can we spend on this as a municipal government? Like it's a decision, I think, because the more units or the more benefits that we add, it's obviously adding to the operating dollars, because of the social housing budget. At this point, there still is some federal contributions, but it's already mainly a municipal responsibility. And the cost to maintain about 2003 numbers, and I don't have the number in front of me, but it's more than $10 million a year to maintain those units and to support people. Again, like, it's a good thing that we are doing that, but the more we add, the more we need to also think about what that means for our budgets. What we do know is that, for instance, and to your point, we are providing more than 2003 units or 2003 benefits, or some of the programs that there's a lot of grandfathering in of different bits and pieces. So we are providing more than 2003 kind of units or supplements. But I think, again, we need to kind of look at, like, how much do we need and how much would we be able to fund from our municipal portfolio. Last thing I'll say about that is that we have seen, obviously, with the introduction of the portable housing benefits, that they are cheaper than the bricks and mortar maintenance. But there's also benefits of having still those bricks and mortar projects as well. So it's trying to, again, and we've only been introducing those benefits over the last 2 years. So it's trying to see what works for what kind of population. So for instance, with the portable housing benefits, we're seeing a lot of people that are now, at the end of their wait time on the wait list, and they have the ability to take a benefit. And those folks that choose that quite often are actually housed somewhere that where they want to stay. They are just paying much more than they should be paying based on their income. So it's definitely all possible, as long as at this point we are hitting our target with the province. Your other three questions, so engagement, are you talking engagement for the terms of reference or engagement for the system review?
Well, with engagement, maybe we'll just keep it general, we've heard a lot, and I've also raised this in the past, that we do need to bring the lived experience to the table. It's a really important voice. And when we do so, we also have to make sure that it's accessible, because people don't always have technology, but it's a really, really important voice. But also our community groups and advocacy groups. And I think more of a collaborative effort. There are probably examples in other municipalities that have done this. Again, I was at a meeting last night from the Social Planning Council, and they had a couple young people, university students from Nova Scotia there, and a person from Queens, speaking about engagement processes too. Like, there are a lot of people we can reach out to who have tried different models. So it's just, even the process, that conversation, what the process will look like, I think it's good to engage the public in that question right from the beginning, even discussing that. So just leave it there for you.
Yeah. No, and I appreciate that. But I mean, again, we obviously have amazing communication staff that help us with engagement, and we it's definitely something that's on our radar to make sure that we engage with the appropriate people that actually, we don't want to do something without engaging the right people, for sure. Yeah, I appreciate that comment. And then the question
that was the same question actually with the encampment strategy, just to make sure we have that. And then the other question was the John Howard Society project that's currently taking place. And it's titled From Prison to Homelessness. And I think there's opportunities to engage with Corrections Canada to see what kind of preventative kind of measures we can, jump in on as a city and help support that project.
Yeah, I appreciate that. We do have a relationship, obviously, with the John Howard Society, just like with many other partners. I am, because of the role I'm in, part of some provincial conversations, including members, for instance, from the Attorney General and Solicitor General. I always get mixed up. But there's definitely a lot of pieces there around discharge planning. There's obviously also a different approach between the federal institutions and the provincial. I think the changes in COVID with a lot of bail hearings or hearings moving to online, there's a lot more unexpected discharge happening, which is obviously a strain in the system as well. So I know I'm going off on a tangent here a little bit, but certainly that is on our radar, and where we can help as a city, we would be glad to do so.
Because prevention should be part of the conversation too. Thanks.
Thank you, Councillor Doherty. I have also seen Andy White's hand. And is there any other show of hands for any other questions following Andy's? Michelle, I'll note you down to follow Andy. Perfect. If you want to.
I'd just like to say, the idea looks amazing, and going into the future, I hope this actually does work and create something that we can all move positively. A couple of questions I do have. Where Ridley is concerned, I thought the RFP had already gone out and there was a lot of people not interested. The other question I have is, well, there are still so many people sleeping rough why hasn't there been another 24/7 warming center opened? I would also like to know, how can people who are still dealing with this situation able to get funding to get a motel room? And the final question is, where do two women go who are over, one is in the age of 70, the other one in their late 60s, who are homeless and afraid to actually go into the shelters? Where do they go? Thank you.
Thank you for those questions. I may actually call upon Joanne in my department as well, who's on the call. So the question, I will start, and then I will probably have Joanne jump in on the kind of the system of the hotel. I'm not sure how I can respond to your last question. I think the reality is we do have a shelter system, and again, I know there might be people that may not, for a variety of reasons, want to access the shelter system, but that is kind of the the avenue that we as a city are able to fund and provide. And I cannot speak to specific scenarios, but again, happy to again talk about those offline as well, or have Joanne on that. For the warming center, again, we as I mentioned last year, we started with the warming center, which was the first time we actually, as a city, funded a 24/7 warming center in addition to our shelters. We now have the integrated care hub on Montreal Street, which is available 24/7. And then, as I mentioned, we do have other facilities. I mean, at this point, again, that's has been our involvement. Yeah, I'm not sure if I can answer why we are not adding another 24/7 warming center. We have provided all these services, and again, I think it goes back to the broader community, the ability of having appropriate resources and appropriate staffing models in place to kind of provide all those services for the moving forward. So again, happy to further have that conversation, but at this point, as a city, we've really focused on having the integrated care hub available, providing additional overflow beds, and really make sure that we support people with various options. I think we just lost Andy for a little bit. For the hotel piece, again, and I will ask Joanne maybe to speak to that, we do have the option, again, for people to if they are accessing the system and they have, they are able to kind of receive the supports in the hotel every day. There are some opportunities. I'm just going to hand it over to Joanne because she can speak to that.
Yes, thank you, Ruth, and through you, Madam Chair. The hotel piece, start my video, sorry. The hotel question does come up quite regularly, and I'm not sure if people are aware, but even in other jurisdictions and municipalities, when hotels are being utilized, as an example, in Durham, Toronto, places like that, people aren't just being put into hotels and motels. There's a staffing component that goes with that. We know that we're dealing with a really vulnerable and marginalized population, many with mental health and addictions issues and challenges. And as a result of that, to take somebody and put them in a room, a hotel room on their own without any supports in place or somebody checking in, that when done without services and supports has resulted in overdoses, a large number of overdoses, because we are still dealing with a very significant and real drug poisoning crisis. And it's also led to some very violent situations where members of the public have in some instances been injured. So what we have to do is balance two very distinct pieces. We have to ensure that the individuals that require shelter are offered shelter supports and services first and foremost, because that's where we're able to ensure that they're getting 24/7 support and assistance. And if they do need to be put into hotels, so as an example, because Lily's Place's capacity has diminished quite significantly, we do have some families that through Lily's Place are in motels at this point in time and are being supported by staff. So the staff do an assessment just to make sure that two things, that the individuals themselves are comfortable being in motels alone and being able to provide, to get themselves food and care and all of those pieces. And also that they're ready and able to do so, because there's a lot of liability involved in that as well if you're paying the hotel bills and something goes awry. So we have to protect the public and the individuals in need of supports. So we do use hotels. I think this year alone, as far as singles go, we've had over 25 or 30 individuals who've accessed hotels, but it's not a program. There's no hotel program that the city runs. What we request is that individuals do attempt to go to the shelters, to talk to staff, to get an assessment, to ensure that they're linked up with the right safety and support mechanisms. And the shelter has had capacity. I know a lot of people want to argue that it doesn't, but the reality is that this shelter has had capacity. And when they don't, they can then make those decisions as to whether or not individuals are suitable for motels. So that's the motel piece. And Andy, to your further point around the two individual women who don't feel ready or able or willing to access the shelters, I would be suggesting that they contact the Housing Help Center, because there's a myriad of services out there. As an example, the prevention and diversion workers at home-based housing should be able to assist people who choose not to go to shelter with other options and other support. So they can at least talk to those individuals, be able to provide them some information, and then brainstorm with them about what other services and supports might meet their needs. Thank you.
Thank you. Andy, did you have any other questions?
No, I kind of lost connection with everybody for some reason on the first part, so I'm not too sure what happened there. I still feel that a warming centre should be opened for those people that still need it, whether there's any mental health, physical, any type of issue. There needs to be another warming centre open so that people can get in there and then get the organizations in to go and ask, see what they need. There are still too many people laying in doorways and hanging around the hub because they can't get in. So that's about it for me right now. Like I say, the slide presentation was good, and I'm hoping that things will develop so that when winter comes, people will not have to suffer like they are suffering right now. I appreciate everybody's input. Thank you.
Thank you, Andy. Michelle, if you want to go ahead.
So I just have a couple of questions. What happens when someone is homeless and they've done their Part A for the social housing registry, and when the annual, like they have an annual review that comes up and they're unable to be reached because they're abroad, they're on the streets, they don't have a cell phone, they don't have maybe even supports like family. What happens when they fall through the crack because they just close their file and then they're not on the list anymore and they don't even know they're not on the list? What happens then?
Through you, Madam Chair. Thank you for that question. That's an excellent question. I will be very honest. I'm not, I don't know all the steps in place, but I do know that we are definitely, we have opportunities to reinstate people if they do, for instance, and it doesn't mean that they're losing their spots. What we are all, and I just referenced that in my presentation, we've certainly been using, an approach again that was kind of that came from the past, where we were really focusing on, actual mail, like letters that we were sending to people, expecting that would, be opened and reviewed. So we are very aware of that. We are also again, revisiting how we are actually going to, what we expect from people at that annual review. So it's a really timely question because we are actually, we don't want to make people ineligible because we didn't hear from them. That's not, we don't want to be in that position, but it's more about how do we then, yes, find a way that we might give somebody a call, or again, with our shelter partners, find a way that we actually have an opportunity to touch base with the client on the phone and have a system in place where we get through a couple of questions so we know we're actually talking to the right person. So it's a great question. It's something that we're also working on making more client focused, because again, administratively, it's also not really it's a process that we would rather spend time on the phone with somebody to see what they're doing rather than bugging them with paperwork.
Thank you. And my last question is, who's eligible for the portable housing benefit? Like, how do you decide?
Yeah. So the portable housing benefit is basically this, it's a new feature, or let me rephrase. So if I apply for the social housing waitlist, a few years ago, I would select what buildings I would be interested in, for instance. Let's say I want to be on Bagot. So now, in addition to the actual buildings, I can also identify that I would like to be eligible for portable housing benefits. So it's like an additional option on the application. So you still have to go through the social housing waitlist process, but then when my name gets, obviously, when my name comes up and I've identified portable housing benefit and potentially also some units, I can obviously then take the portable housing benefits. We've seen definitely that there's more people still interested in units versus the portable housing benefit. So again, we don't have there's not enough time yet that we can really assess how long it takes to wait for that portable housing benefit, but that's how you can kind of picture it. I will say, not to make things more complicated, but we also have a portable housing benefit in partnership with the province that is specifically for domestic violence survivors. So those are prioritized. So there's a couple of different components there, but for the kind of new general portable housing benefits, that is really the way to kind of access those are really through the social housing waitlist.
Thank you very much for your answers.
Thank you, Michelle, and thank you, Ruth. Are there any other questions from the committee? So I will note regarding the terms of reference review, and it also sort of links back to the correspondence that we'd received. So, for example, we might want to rethink the committee composition in regards to Indigenous representation. So that's the type of thing as well that is going to be reviewed by that working group. So there's many critical components that the working group is going to be looking into, but I wanted to just take a moment and mention that in reference. So we will move into business, and prior to me asking if there are members of the public present who would like to speak, I will just check in again with the committee. Were there any other questions from the committee that we can now address under business before we move into our item for business and vote? Okay. So I don't see anyone. So I will ask Elizabeth, our clerk, is there anyone from the public with us today that would like to speak? Elizabeth.
Thank you, Madam Chair. I'm just going to remind the members of the public who are with us this afternoon, if they wish to speak at this time, they will need to use the raise hand function that's located in Zoom. You can find that by moving your mouse over the window, and it's located at the bottom of your screen. And Madam Chair, if we can just give a couple of seconds just in case there are any hands.
Absolutely.
And there is, Madam Chair. I'm going to ask Colleen if she would like to unmute herself. Perfect.
Hi, it's Colleen Garrow. I'm with the YMCA of Eastern Ontario. It's the first time that we have joined in to observe one of these meetings, and I just wanted to thank Ruth and her team very much for that really good presentation. It was very thorough and gave us a lot of information, and that was really my only comment, was to thanks very much for that.
Thank you, Colleen. Elizabeth, was there anyone else from the public as well?
There is, Madam Chair. I'm going to ask Tina if she'd like to unmute herself.
Hi, good afternoon, everyone. It's Tina Bailey here, and I also, it's my first time popping in on one of these meetings, so thank you very much for the opportunity. Just thought I'd ask, and if it's not appropriate, I can follow up with Ruth individually after. I'm just trying to reconcile what I'm hearing anecdotally with some of the statistics about the vacancy rates, showing that the shelters are 49 to 88% vacant. So I'm just wondering what the time frame for that was, if there's any correlation to the weather, etc. And wondering if there are also stats about if and when, how often people are turned away and why that is, if it's for a capacity, lack of capacity issue, or if they don't meet the criteria, for example, violent behavior, intoxicated, etc. And I'm just wondering if that's part of the reconciliation of the different perspectives of if our shelters are full or not. Thank you.
Through you, Madam Chair, thank you for that question, Tina. So I will ask Joanne to jump in here as well. So the number is an average. So again, the percentage might be a little off, or off as in it might not, show the picture. Again, I think it's over a 6-month time frame that we measured it. Again, there is a bit of a it's an average, so it might not give you a really good picture. As for the number of turnaways, I would suggest that Joanne would probably answer that, because she's much better at answering that question than I am.
Thank you, Ruth, and through you, Madam Chair. So turnaways, I mean, it's certainly a stat that we look to try and capture in our reporting documentation when service providers are updating their statistics. And you're right, there are absolutely turnaways from shelters and organizations throughout the community. That tends to be as a result, as you mentioned, of either violent behavior or an inability for one to care for themselves or others. And in that instance, there would be a diversion potentially to a safe bed or to emergency or somewhere like that. So those numbers are, I mean, again, we don't have those numbers on us right now. We can certainly look them up. The city is looking at a way to potentially in a second or third quarter be able to provide information to the public on our webpage with more statistics so that people have a really good, clear picture of what's going on within the system itself. But the truth is that the shelters, Ruth is correct that is an average over the last 6 months. So when you see it as an example that the youth shelter is at 49%, it seems alarming. That doesn't mean that they've been at 49% consistently. What that means is that's just the average. And we do sometimes see a correlation between weather and when people look to move more indoors. And then we also know through our street outreach team that we do have some individuals that will just not access shelter regardless of what the weather is outside or what time of year it is. So those are shelter averages. We don't make those numbers. Service providers input their numbers into a system, and we're able to collect that data and aggregate that data. So I do hope that helps. Thank you.
Tina, did that help with your question?
Yes, thank you very, very much.
Thank you. Elizabeth, were there any other members of the public?
Madam Chair, there are no other members of the public that wish to speak.
Okay, perfect. So we will move then to our recommendation. So the recommendation is that the Housing and Homelessness Advisory Committee recommends to the Arts, Recreation, and Community Policies Committee that a Housing and Homelessness Review Working Group be established to develop updated terms of reference for the Housing and Homelessness Advisory Committee, it being understood that the working group will be comprised of not more than 4 members of the Housing and Homelessness Advisory Committee, to be selected by the committee to work with city staff to seek input from the community and report back to the committee by the end of Q3 in 2021. Can I have a first for this? Councillor Doherty, thank you. Can I have a second for this? Tara, thank you. And then if I can ask if there are any other questions, any other discussion before I request votes in favor or against. Okay. Can I see a show of hands for votes in favor?
Sorry, Madam Chair, it looks like Councillor Neal had a point of order to raise before we go to the vote.
Sorry
No
about
problem.
that. My
Sorry
apologies.
to interrupt the vote. You're probably on the right track here. I'm just curious. The public that participated before, was that on this particular motion? Or was it on the earlier report that we got from Ruth? Just looking to the clerk for that. So, sorry, I'm putting you on the spot.
Madam Chair, if I may. So members of the public are only permitted to speak to business items. They are not permitted to ask questions of the briefing itself. In this instance, they did ask some questions about the information that was provided in the brief. However, it was to deal with the business item as well.
Thank you. You're way ahead of me. I appreciate it. I've been doing this a lot longer than you. I should have known that. Thank you.
And sorry, I didn't see your hand before. My apologies. So I'm going to go back again. We have our first and our second, but I'm going to go back again and re-request votes. If I can see a show of hands for those in favor. Perfect. So that carries unanimously. Thank you, everybody. So then we will move over to motions from the committee. There are no other motions listed on the agenda. For notices of motion, there are also no notices of motion listed on the agenda, but are there any to be included in a future agenda? Are there any notices of motion? Okay, seeing none, we'll move over to other business, and I do have statement or questions from Andy White noted here. Sorry, Andy, this is over to you for other business statement or questions.
Actually, most of the questions that we were referring to, I've managed to ask because my main concern right now, even though this is good, I have been on the streets, I've been over to the hub, I've talked to people who are dealing with such bad situation. There's a couple of people who've got frostbite. There is so many negative things going off that I just wanted to make sure that people are more aware. I know you have to collect stats that come later on. It's just the way things are. But like I say, there are still too many people out there that need somewhere to stay 24/7, even if it's a chair. So no, I appreciate your patience with me on this. But hopefully the public will be able to start asking a lot more questions and getting a lot more answers. So thank you for bearing with me, and I appreciate it from all of the members and the city staff too. Thank you.
Andy, thank you. And, you know, I will just say what you've done and going out and reaching out and having the questions that you have it's wonderful, and it's from exactly the right place, and it's exactly what we need. I'm, thrilled that there is involvement, and that's exactly what we need. So I think the working group is is going to be able to evaluate for any changes to our terms of reference for this committee. Of course, there's a formal process to follow, but I acknowledge and appreciate that everybody that is on this committee is a volunteer and has their heart in the right place, and it's a beautiful thing. So thank you, everyone, for that. Okay, so then, as there is no other business, I would like to also take a moment and just acknowledge the correspondence that was sent to us. Thank you for submitting your correspondence. I appreciate that very much, and I found it very, very helpful to read. And again, it does tie back in with the whole point of this meeting being a special meeting to review for a working group. So then the next item on the list would be the date and time of our next meeting, which is currently scheduled for Thursday, April 8th, 2021 at 1 p.m. Unless we have any meeting that were to come up between now and then, a special meeting, for example, like this one, which I called. So then we will move to adjournment. And if I could have a first for adjournment. Thank you, Michelle. And I will take a second for adjournment. And I assume all are in favor. Thank you. Thank you, everybody, for being here and for another lovely meeting. Thank you.